Hi everyone, my name is Roya Habashi from your Psyc101 course, and today I'm going to be exploring generalized anxiety disorder, panic disorder, and specific phobia. So let's start with generalized anxiety disorder, also known as GAD. Many of us have experienced a case of anxiety at some point in our lives. So think about a time that you've experienced anxiety. For me, some that comes to mind are when you don't wake up early enough to your alarm and you're running late to work, or if you feel really unprepared for an exam that's coming up tomorrow morning. These examples are not generalized anxiety disorder. This type of anxiety is different than generalized anxiety disorder. GAD is when one experiences anxiety on a day-to-day basis for 6 months or longer without any specific trigger. It's just a feeling of lingering anxiousness and nerves all the time. Some associated symptoms include fatigue, insomnia, irritability, sweating, and restlessness. Terlizzi 2020. There are both biological and environmental factors that contribute to the cause of GAD. So let's explore those now. Let's start with some biological factors. And one is that GAD has been linked to a deficiency of GABA, GABA. This stands for gamma-aminobutyric acid. GABA is a neurotransmitter in the human body that inhibits neurons from firing. King 2022. So basically, this means that there's an excessive amount of action potentials in which cannot be controlled. GAD has also been seen to be irritable and genetic, where some individuals can be predisposed through the passing down of genes, like from a mother or grandfather who suffered from the same disorder. But it does not have to be genetically passed down to be diagnosed with GAD. Studies of the central nervous system and respiratory system have also shown an increase of stimulus from the amygdala in the brain when exposed to worry and a sense of panic. When one senses panic, they'll breathe in higher amounts of CO2. So your body reacts to that and brings you an increased heart rate, sweating, and many of the symptoms that are associated with GAD. It was also found that those with GAD had amygdalas that process feelings of despair and misery in a different way than the normal brain. Mishra 2023. Moving on to more personally triggered GAD reasons, one who has grown up in a more maybe clean-cut and intolerable household that seems to be more of a perfectionist and critical of themselves may create a sense of doubt within themselves over anything. These kind of people can develop GAD. This is especially common for those who have dealt with domestic abuse and other sorts of trauma. Ones who experience stress on a day-to-day basis due to finances, work responsibility or workload, or expectations placed on themselves have a higher risk of receiving GAD. Also, if one is unstable, like if they change their location often and never settle in one place, makes you always feel like you're on the move and starting over, you can also develop generalized anxiety disorder. There's a couple different treatment types for generalized anxiety disorder. Looking at the biological mechanism, if one is deficient in the neurotransmitter GABA, supplementing GABA through medication could allow for inhibition of neural signals. And an example of this kind of medication is Lyrica. There are also SSRIs, which are selective serotonin reuptake inhibitors, and these are antidepressants that can assist with generalized anxiety disorder. And some examples are venlafaxine, fluoxetine, and pregabalin. Aside from medication, psychotherapy and cognitive behavioral therapy has been seen to help patients who suffer from GAD, where talking through situations can make one more aware of the disorder to get a grip on it, especially if they're close to their therapist. King 2022. Psychotherapy hits different points in one's umbrella of life, such as their social skills, mental health, relationships, and physical activity. This can help diminish negative thoughts or compulsions in which trigger anxiety. Mishra 2023. However, it was found that many of these treatments were inaccessible to patients in a study due to their price and intolerability, where only 20 to 32% of patients are being treated for generalized anxiety disorder, reported in Aucoin's article written in 2023. Now moving on to panic disorder, which is a subtype of generalized anxiety disorder. Like anxiety disorder, panic disorder is not a one-time occurrence, like when you lose your wallet and have a 5-minute freak out before finding where it was last left. Panic disorder is a chronic episode of fear without any specific trigger, and it is usually associated with shortness of breath, perspiration, shaking, dizziness, chest pain, and emotional agony, to name a few. King 460. These feelings can be compared to those of a heart attack and are not due to a direct effect of a substance or diagnosed medical condition. These symptoms can last for a few minutes to even hours, depending on the severity, and they come on without any warning. Again, there could be genetic causes or more environmental causes of panic disorder. One can be genetically predisposed to this disorder or can have chemical abnormalities, such as higher levels of lactate, or, like in generalized anxiety disorder, a deficiency in the neurotransmitter GABA. If not genetically, there has been correlation of panic disorders and learned processes where our body relates high levels of CO2 to fear and panic in the body. This is why panic disorders are diagnosed in more women than men, since women cope with fear at higher CO2 levels in a more elevated scale than men do. King 46. There has also been a correlation between those diagnosed with panic disorder and a dysfunction in the fear network in the brain, where the amygdala is inappropriately activated to release stress or fear responses without any stimulus. Zolfarina, 2019. So there's a few different treatment options for panic disorder. These include psychotherapy and medications with calming effects, including cognitive behavioral therapy and mindfulness interventions. Kim, 2019. Cognitive behavioral therapy is finding the internal negative thoughts that may contribute to a disorder and tackling them head on to eliminate the negative feeling. These treatments are also more long-term, where panic disorder has been associated with medical comorbidity or psychiatric complication. So relapse is very common when psychotherapy is halted. Zolfarina, 2019. Psychotherapy helps one understand their feelings, thus understand their reactions and how to control them. There are also group therapy and specific supposed groups in which helps patients feel a sense of community in their diagnosis and allow them to get more info and insight into the panic disorder and how to achieve their internal balance. As for pharmacological interventions, there are SSRIs again and SNRIs. One can also take tricyclic antidepressants, which are TCAs. Examples are the venlafaxine, sertraline, fluoxetine, imipramine, and these are all from Zolfarina 2019. These are antidepressants, so this can help with those who feel that sense of anxiety and depression that comes with panic disorder. There are also lifestyle changes one can make to reduce the effects of panic disorder, such as a reduction in alcohol, caffeine, and sugar intake and consumption, as well as getting an adequate amount of sleep, about 7 to 10 hours of sleep, and physical activity of at least 30 minutes a day, and 60 minutes a day would be even better. Lastly, we're going to explore specific phobia. This is another disorder that falls under anxiety and panic disorder. It kind of brings the two together. Specific phobias are being fearful of something, but to the extreme, where one would do anything to avoid that specific thing. It's so extreme that where if someone suffered from a phobia, let's say to the sun, they would never go outside and rather sit at home and avoid its exposure. King 46. Specific phobias are often developed between ages 4 through 8. These phobias can last for years or even decades and can even be lifelong, where they become prevalent in childhood and peak during midlife. They are also found to be correlated to disorders such as anxiety disorder and substance abuse disorders, from Eaton 2018. There are categories of specific phobias, which involve situational phobias, animal phobias, injury-type phobias, like the doctors or needles or blood, nature phobias, and uncategorized or other phobias that are a little more random. Some of the most common specific phobias in the world are claustrophobia, or the fear of being in a confined space, aerophobia, the fear of flying, arachnophobia, fear of spiders, and even driving phobia, the fear of driving a car, and sometimes even being near or in a car, one more severe. Let's look at symptoms of specific phobia in two different formats, physical and emotional. So some physical symptoms one may experience when undergoing a specific phobia sort of attack is a dry mouth, chest pain, increased heart rate, confusion, chills or hot flashes, feeling faint, fainting, or dizziness. Some emotional feelings are impending doom, that death is near and imminent, feeling out of control of one's body and situations, anxiety, and stress. There's a few causes of specific phobias. Sometimes there's no cause at all, but let's explore first genetic. Phobias can be passed down, but once again, they do not have to be passed down to get a specific phobia. So one can have a specific phobia without having any genes in their family related to phobias whatsoever. Specific phobias are thought to be learned, like if an individual had a bad experience with something, they can develop a phobia over it. A frightening event or traumatic experience, or even a learned phobia from a parent or family member during childhood, can all lead to the development of a specific phobia. An example is, let's say someone went swimming in the ocean and got stung by a jellyfish. They may develop a phobia to the ocean, to jellyfish alone, to swimming, to going on a boat, or even being near a body of water after this experience. And that's just different severities. Connecting to our previous topic of panic disorder, it's been found that people who have panic disorder also have agoraphobia, which is fear of being in a place where leaving or escaping is not possible. And if they were to experience panic attack symptoms, no one would be there to help them. And this was from Zolfarina 2019. Many people do not seek treatments for specific phobias because simply avoiding the phobia can be a way to mitigate all the symptoms that come with it. But for other individuals, multiple specific phobias develop in which become too overwhelming to handle, so treatment is sought out. The phobia can also be something very common in everyday life and cannot necessarily be avoided. So for one's health, relationships, daily activities, treatment is desired. A primary line of treatment is exposure therapy, and there's 3 different types. Desensitization is when someone is exposed or introduced to the entity that they fear little by little until they can handle it to the point where it no longer becomes a phobia for them that controls their daily life. So, for example, they'd first be exposed to maybe pictures of the item, videos, can go near the item or look at the item from afar, and then finally be able to be hand in hand with that phobia without experiencing the associated symptoms. There's also virtual reality therapy, which utilizes virtual reality to test out limits with the phobia and expose little by little as well. And then there is in vivo, which is just jumping in and being exposed to the phobia in real time. Pharmacotherapy is another source of treatment for specific phobias, but it is not as common because most medications used for specific phobia are to treat maybe the anxiety and depression side of the disorder. So beta blockers can be used in which assist with the anxiety associated with phobias. SSRIs and TCAs are for the depressive side of phobias, and then some tranquilizers such as trazodone or Xanax can be used for that anxious and overstimulated side of phobias. So bringing these disorders all together, anxiety disorder, panic disorder, and specific phobia disorder, they share a lot of symptoms, physical and emotional symptoms, in which they cause a lot of stress to the individual, a sense of fear, perspiration, heart palpitations, and chest pain are very common. We also see that these disorders can be passed down genetically through genes from their parents or grandparents, or they can be completely random, and someone can develop one of these phobias from a particular event or no event at all. We see these 3 are more common in women than in men. The root of anxiety disorder is already more common in women. We looked at how an increase in CO2 levels during fear can cause an increased amount of anxiety in women than men. And then we also see all 3 of these are a huge obstacle in one's daily life, and are sometimes unavoidable and cannot be ignored. And they all utilize some sort of therapy, whether it's psychotherapy, group therapy, or exposure therapy as a first line of treatment. And this brings us to the next topic of family and couples therapy, in which I will explore in my next PowerPoint. Thank you so much, and you can find a few of my references on these pages.